friends, welcome back. If you are new to my channel, I'm Jasan. I'm a nurse and the first-time mom sharing my experiences with motherhood, tips, and my knowledge to help other first-time parents. Being a new parent can sometimes feel like you're grasping at straws. I am here to provide you with the information you will need to make it a walk in the park. So in this video, I will help you understand the newborn screening process so that you will have an idea of what to expect once you have given birth. So you are having a baby. Congratulations! It's the most wonderful and fulfilling experience. Remember when you found out you were pregnant? Wasn't that an amazing feeling? I can remember jumping around and dancing. Through your pregnancy, there will be several tests and checkups, all to ensure your baby is growing well. The 9 months will breeze by, although for moms, this does not always feel like a breeze. Soon, it will be time for labor and delivery. Once your labor starts, your contractions will become more and more intense. You will more than likely be in a tremendous amount of pain. But through all of this, you are super excited. You'll be able to hold and see your baby for the very first time. Once baby is born, newborn screening is routine to ensure baby is healthy and put in a position for early interventions if necessary. As parents, the well-being of our children is first priority. Newborn screening is the first step to your baby starting a healthy life. So what is newborn screening? This is a blood test that is done within the first 24 to 48 hours to detect or rule out rare serious conditions that can be treated if found early. If the child has a disorder, early detection is vital. This will give your baby the opportunity to receive appropriate treatment for the best outcome. Babies can look normal and still be at risk for serious health problems or even death, so screening is very important. This is not to scare you, but to help you understand the importance of early detection. With that said, only 1% of babies will test positive for any of these rare disorders, so don't worry. The screening process will start with a lab technician pricking your baby's heel to get a few drops of blood. The blood is then collected on a test strip with a few separate sample areas. That strip will be sent to a lab where they will test for metabolic disorders, endocrine disorders, and they will also check for hemoglobin problems such as sickle cell. A metabolic disorder is the body's inability to metabolize certain molecules due to a lack of specific enzymes. Some examples of metabolic disorders include the body's inability to break down amino acid. High amounts of amino acid in the blood can affect brain development, causing intellectual disabilities. Inability to convert fat to energy, which can cause your baby to become lethargic, meaning their lack of energy. Low blood sugar, seizures, and liver damage. The inability to convert galactose to glucose, which can cause damage to the liver, kidneys, eyes, and the brain. There can also be a buildup of ammonia, which is a toxic gas. High amounts of ammonia in the body can cause poor growth and issues with your baby's nervous system. The inability to break down and absorb protein is also another one, which can cause organ damage and organ failure. Next, we have endocrine disorders, and these are hormone-related illnesses. The first one is going to be diabetes mellitus, and this is also called type 1 diabetes. This is where the body is unable to produce enough insulin or maintain normal insulin levels. Next is acromegaly, and this is the production of higher than normal growth hormones. Following this, we have Addison's disease. This is a result of low hormone production in the adrenal glands located on top of the kidneys. Next, we have Cushing's disease. This is an increase of cortisol levels in the body. Then, Graves' disease, high production of thyroid hormones. Hypothyroidism, and this is a low thyroid activity. Hyperthyroidism, and this is high thyroid activity. The last example I have here of endocrine disorder is prolactinoma, and this is an excessive production of prolactin in the pituitary gland in the brain. If the screen is negative, the result will be sent to your healthcare provider as well as the hospital of birth to be placed in your baby's health records. If for any reason they were not able to complete the screening at the lab, they will require new samples for retesting. This could happen for one of several reasons, one of which could be that the sample was not collected properly. If there's a positive result, again, it will be sent to your doctor and the hospital along with a report. A positive result does not mean that your baby automatically has a disorder. What it means is that more testing will need to be done before a diagnosis can be made. In this case, your doctor will contact you to discuss the results and give instructions regarding how they will be moving forward. Test results usually take 5 to 7 days. Remember, no call is a good call. I know you're excited to meet your baby, and it can be hard not to think about all the things that could go wrong. We all want our babies to be in optimal health at birth and throughout their lives. Maybe your due date is approaching and you're getting anxious. This is understandable, but please try to keep a positive mindset. I hope this was helpful and you now have an idea of what to expect during your baby's first screen. More importantly, now you understand what they are checking for and why it is necessary. Like the video and subscribe for more helpful mom and baby related content. Congratulations again and thank you so much for watching. I'll see you again in the next one.